Hello everybody, good afternoon, and my name is Dr. Asa Frey. Today we are going to be talking about how to reverse diabetes. If we have never met before, again, my name is Dr. Asa Frey, and today we're talking about how to reverse diabetes. I am a doctor, a co-founder and co-director at Back to the Garden PR, that is Clinica Back to the Garden PR. We are a center for chronic disease reversal, as well as we specialize in supervised water-only fasting. We have an inpatient facility, which is a residential facility in San Juan, which is where our patients come to stay with us and fast while they are monitored by skilled professionals. And we watch them get well as keep a very close eye on their progress. We also have an outpatient center in Hato Rey, where we monitor our patients on an ambulatory basis. These are patients who are on more long-term health programs. But we focus on chronic illness. Most of our patients have any type of chronic disease. This includes diabetes, high blood pressure, heart disease, types of cancers, autoimmune disorders like rheumatoid arthritis, lupus, Sjogren's syndrome, Wegener's, ulcerative colitis, any type of intestinal or bowel issue, as well as skin issues, psoriasis, acne, eczema. So, before we begin today, I need to make a couple announcements. First of all, si usted quiere aprender más, tú necesita visitar nuestro website, okay, backtothegardenpr.com. If you want to learn more about our services, please visit the website backtothegardenpr.com, and all the information is there for you about our residential center, our water fasting programs, as well as our ambulatory health programs. So go there. There's all the information is there. Read it first and then call us if you want to learn more. I assume that everyone can hear me, right? Everybody can hear me. Give me a thumbs up. We got 20, 21 people, and we're about ready to go. So our next workshop is on the 24th of September. Okay, this is an intestinal health or a gut health workshop, which is a very popular term on social media and in doctors' offices and trainers and health coaching offices as well. You're going to learn about the digestive system, how it works, as well as important information about the microbiome, which is the community of bacteria that live specifically inside your intestines. We also are going to talk about things like kombucha and probiotics and other products that you may have heard of that propose themselves to better the intestinal flora or bacteria in your gut. So today, yes, thank you for the thumbs up. Welcome everybody. My wife has gone over the top 3 things that people do that are mistakes which can cause diabetes. Okay, the top three mistakes that you can make to cause diabetes. What are these? Well, we're going to go over these very quickly, but first, talk about what diabetes is. Diabetes is a condition that affects more than 30 million people in the United States and Puerto Rico. Okay, it is the syndrome of altered metabolism of carbohydrates, amino acids, and fat. So this is not just a condition that focuses on carbohydrate or high amounts of glucose in the blood. This is a systemic metabolic condition. This is caused by a lack of insulin secretion or a decreased sensitivity of the tissues to insulin. Okay, that is called insulin resistance. Right? There are 3 types of diabetes. We have type 1, we have type 2, and we have gestational diabetes. Right? Today, since about 80 to 85% of all the cases of diabetes are type 2, we are going to be focusing on type 2 and how to reverse type 2 diabetes. Right? We're going to go over some specific information about the cause of diabetes, and then we're going to talk about some clinical cases where you can see for yourself how patients can significantly decrease medication or get rid of medication altogether. And this happens when we address the cause of diabetes. All right? Everybody good? We ready to go? So we work with all types of patients, all types of diabetes, both type 1, type 2, as well as gestational. Most of the patients we see are type 2. However, the information you're going to learn today, you can utilize to affect your insulin needs, which is what you should be trying to keep as low as possible if you have type 1 diabetes, right? You don't want to have to use a large amount of insulin. You want to use as small a dose of insulin as possible. Okay, so what's next? We know that insulin is secreted in association with the abundance of energy, right? When there's an excess of energy, insulin is secreted in order to metabolize and store and get rid of the excess, right? This is not only with carbohydrates, this is also with excess amino acids and fat. So this plays a role in the storage of our excess no matter where those excesses are coming from. Risk factors for diabetes. Most of the time, people with diabetes are overweight, they have high blood pressure, they have high cholesterol, they have heart disease and cardiovascular disease. This is why they call it metabolic syndrome, right? This is not just a disease that affects the pancreas specifically or affects just the muscle cell. This is a systemic disease, and we have to look at it and manage it in a systemic fashion. What is diabetes caused by? Well, insulin resistance is most closely associated with lipid accumulation in the muscle cells. So everybody understand what that means? Lipid accumulation in the muscle cells. This is called lipotoxicity, ectopic lipids in the skeletal muscle. Okay? This turns out to be the major factor of insulin resistance in type 2 diabetes. How do you get insulin resistance? Well, it's very easy. If you want to get insulin resistance very quickly, just eat tons of fat. Right? Processed oils, lots and lots of animal product, cheese, dairy, eggs, and animal meat, especially because of the high amount of saturated fat in those foods. The number one mistake that people make when they are trying to prevent themselves from getting diabetes or they're trying to reverse it, right, is that they're not eating enough vegetables, okay? You don't eat enough vegetables, your diet becomes inherently low in fiber as well as micronutrients and a multitude of other bioactive compounds, which will decrease your risk for developing type 2 diabetes, right? Even eating like two or three servings per week, right? That's like 10 pieces of broccoli, right? 2 or 3 servings per week can significantly decrease your risk for developing type 2 diabetes. Another reason that a diet that is abundant in vegetables is because vegetables are very, very low caloric foods, right? They're very, very high in nutrition, but they're very low in calories, right? So that is a good return on investment of your calorie dollar, if you will. You have 2,000 calories to spend during the day, and vegetables is you're going to get a very, very high return on that type of food. So it's lots and lots of nutrition, which is great, and not very many calories, which means that it's very, very difficult for you to overeat, right? You don't want to gain weight, especially when you're trying to reverse or prevent diabetes. You want to slim your waistline, and high amounts of fibrous vegetables is going to help you do that. Again, if we have never met before, my name is Dr. Asa Frey, and today we are going over how to reverse diabetes. And welcome, everybody. Welcome, everybody. So the second mistake that people make is they avoid fruit, right? Fruit is also a very low-calorie food, which is very, very high in nutrition, and typically people with diabetes are avoiding fruit, and that means they're missing a bunch of antioxidants, chemicals that reduce inflammation and improve endothelial function, right? The constituents of fruit are going to act pretty much the opposite of the animal products, which are going to increase, they have no antioxidants, they're going to increase inflammation, and destroy your endothelial lining. Most fruits have a low glycemic index, so if you're paying attention to that, most of the fruits are 55 or less. And in glycemic index terms, that's around the same level as vegetables, whole grains, and beans, right? These are very incredibly healthy foods. So, the third reason that Dr. Joanna went over the other day, the third mistake that people make is they are just eating too much processed fat and animals. Okay, that is a huge mistake, and people certainly do that all the time, thinking that, oh, well, they can't eat the sugar or the carbohydrates, so they turn to the animal products and the processed foods, and that really just snowballs and makes their diabetes worse. And this is why people spend years and years and years with diabetes and they never get better. Are dry fruits are good? Well, dry fruits, that is a very good question. Dry fruits is a fruit that is dried. And what happens during the drying process is you get rid of a lot of water. Okay, the high water content of the actual fruit is one of the reasons that fruits are so good for you, right? So with a high water content, a high fiber content, and a high nutrition content, those fruits are going to nourish you as well as fill up your stomach. If you've ever eaten dry fruit, I mean, I can eat, I could eat 10 mangoes in 5 minutes if it's all dried, right? So I'm getting more calories than I really should be from drying the fruit. Now, dried fruit here or there is really not going to cause you an issue, but if you're eating dried fruit every day, I think that's something that you need to be careful about. Esperanza, good question. I hope I answered that for you. So how exactly do you reverse diabetes, right? How do you reverse diabetes? Now, there are plenty of videos on YouTube, people selling products, special pills or powders or potions or diabetic teas or a special root that is going to act the same as insulin. We're not going to talk about those today. These products, claim to, reverse your diabetes in a day or reverse it in a week. If you're ready for that, then great. But what we are going to talk about here today are actual clinical cases that we have in our clinic and that we see improve and the condition reversed on a daily basis. So we're going to go over some of those clinical cases, okay? As always, our clinic is very specific. Every case is different, and we do need to do a proper workup on all of our patients to ensure that we are making the right progress. Okay, that means that we take a very detailed history, right? We're physicians, and so we play it like doctors. Okay, we take a very detailed physical examination, we take a history, we do the appropriate laboratory tests that are necessary to acquire enough information to figure out what exactly is the cause of your problem, right? That's pretty important that everybody understands. So our first priority always is to take the time to find out what is the cause of the problem, address the cause, and then we can begin to create an environment that is favorable to health in that particular patient. Okay? There are no magic pills or potions. They do not exist, and we certainly do not sell them at our office. We try and pay attention to the cause first, and that is why we have the high success rate that we do. So our first case is a very interesting case. This male has been diagnosed with diabetes for the past 30 years, okay? Over 30 years. So for 30 years, this patient has been taking medication, right? Started with probably metformin, and then they added in different types of insulin. And by this time, when he came to our clinic, he was on 3 to 4 different types of insulin along with metformin, but that is not his only issue, right? What about potatoes and starchy food for a diabetic person? Isis, first I would say that you really need to address the cause of the diabetes, right? For a person who is not, not on good track, right, who is not eating a healthy diet, who is still eating processed oils and animal products, and oils and salts and sugars and flour, right, and they're still eating calorie-dense foods with very little nutrition, then you're going to see large spikes in their blood sugar when you do eat potatoes and other starchy foods, okay? But the research has shown if you clean out the processed food and the fat from the diet, then those potatoes and starchy foods and fruit, they're going to have a acceptable sugar spike. I mean, that is what happens when you eat food that contain carbohydrates. You'll have a spike, and then the sugar is supposed to come back down, right? And it's the insulin secretion and the sensitivity to the insulin that will bring that sugar out of the bloodstream, use it, utilize it, burn it, turn it into carbon dioxide and water, and then you're fine, okay? So in our clinic, we see people who are unhealthy, they have diabetes, they're not eating a healthy diet. And when we get them eating a healthy diet, maybe we fast them for a period, those potatoes and starchy foods are not going to be an issue for them, okay? In fact, they're going to be able to eat in abundance of those foods, okay? And we see that in the literature with many studies over rice, where they basically feed diabetic patients rice and table sugar, right? White sugar. And their HbA1c's come down, their fasting glucoses come down, their insulin needs come down as well. So they actually do better with the diet that is just severely limiting fat. But you don't need to get rid of, very, very nutritious, complex carbohydrates, okay? Yeah, I don't think that it's a good idea to say no to potatoes. I think it's a better idea to address the cause of the insulin resistance, right? And reverse the diabetes. If you continue doing the same things that are causing your diabetes, and then you eat potatoes, well, you're really not going to have a lot of benefits doing that. Does that make sense? I hope I answered your question. Yes, many nutritionists are going to say no to potatoes, but you have to understand that each practitioner learns something very different in school, and she learns that that a nutritionist is supposed to put their patients on this sort of diet for their diabetics, but really what we should really want to do is give our patients the information, right? Give them the research, give them the best in the scientific literature, and then they can make their own decision, right? So if they really want to reverse their diabetes, give them the information on how to do that. Okay, so if they have that information, that latest in the scientific research, which has really been quite consistent for the past 100 years, they should have that information first, and then the patients can make a more informed decision. Right? That's what we do. So, as I was talking, this patient has been on medication for 30 years. He's diabetic. He was diagnosed with diabetes over 30 years ago. Middle-aged male. He's not obese, moderate exercise, but he also has other issues, right? He's not just diabetic. He doesn't only have problems with insulin resistance. He also is hypertensive. Okay, so he has problems with his blood pressure, right? This is typical of patients who have diabetes. And he's got high cholesterol. So he's on medication for high cholesterol, but also on medication for high blood pressure, right? Okay, so what do we do exactly with this patient? Okay, I know you guys are all waiting to see what exactly we do. So we take a detailed history, right? We do a physical examination. We take the appropriate laboratory tests to find out more information about why this patient is sick in the first place. I hope that makes sense. Now, after we do that, we create a plan for this patient to get better. The plan that this specific patient followed, it turns out that this patient was a great candidate for a water fast. And so we prepared this patient for about a month or two, eating an incredibly abundant diet. This is not a restrictive diet. He's eating an incredible abundance of fruits and vegetables, as well as starches, and severely limiting his fat intake. Of course, he's not eating any animal products, oil, salt, sugar, or flour. Okay? Animal products include meat, fish, fowl, pigs, cows, chickens, fish, but also eggs and any sort of dairy product. Right? Yogurt is made from milk. Anything made from milk would be considered a dairy product. So that includes ice cream, butter, lard. Okay? So this person does his fast, right? He fasts 2 times, which is not uncommon for a person who has severe diabetes, right? This person has been diabetic on medication and insulin, right? 7 different medications, 4 for his diabetes, for 30 years, okay? 30 years. So we do 2 separate fasts. The first water fast he does, and of course we monitor him and he stays with us at our center. The first fast he does is for 14 days, and then we take a break and we recover from that first fast and prepare him for his second fast. That takes about 3 to 4 months. And at the end of 3 to 4 months, he does another fast. It happened to be a short fast of 6 days. Okay? Now, during this process, the patient is going to see his general practitioner, right? He's going to see his GP. We work all the time with any type of doctor, right? Because we are all supposed to be on the same team, right? It is about the health of the patient and the recovery of the patient, right? So we work with doctors of medicine, we work with doctors of chiropractic, doctors of naturopathy, and doctors of osteopathy, nutritionists, dietitians, nurses, you name it, okay? So the results of this, after this patient fasted 2 times, he has maintained a 20-pound loss. So he lost 20 pounds. He's now at a much more healthy weight. He was able to safely eliminate all his cholesterol medication and all of his high blood pressure medication. Now, what does that mean? That means that his blood pressure is now low enough where there is more risk in taking the medication than there is in not taking the medication. So as he's going back to visit his primary care physician, he's taking new labs, new blood labs, and we take a look at those. They have to lower his medication. Okay, so he now has a normal arterial pressure. He also has a normal level of cholesterol. Okay. Now let's talk about diabetes. His HbA1c, which is hemoglobin A1c, which is a marker of long-term glucose in the blood, this used to be at 6.8, which is grossly out of range for a healthy person, right? You need to be at least under 5.9, 5.8, okay? So his hemoglobin A1c is now 6.1, right? 6.1 from 6.8. Keep in mind, he was on 3 to 4 different medications for his diabetes. Okay, so you're getting a decrease from 6.8 to 6.1 in 6 months, but that doesn't include the effect of the medication, right? So he was able to safely get rid of all insulin, okay? I hope everybody hears that. He was safely able to eliminate all the necessity for his insulin medication. The only medication that he continues with is a small dose of metformin on a daily basis, but he no longer requires any insulin. Okay? His primary care physician was extremely excited to get rid of all the relatively dangerous medication he was on before, the high blood pressure medication, the cholesterol medication, and excessive amounts of insulin. Okay? So the specific doctor of medicine that we were working with was extremely excited because she doesn't get to see that. And those kind of benefits really do warm the heart of any true physician. Welcome, Dwight. Haven't seen him in a long time. So, our second case we're going to talk about is a female, and we did talk about a severe diabetic case, someone who had been diagnosed and taking medication for over 30 years and was able to decrease all his insulin needs as well as his high blood pressure medication and cholesterol, and only remains on a small amount of metformin. Now we're going to talk about someone who was just recently diagnosed with diabetes. This is a female, about middle-aged female, and she comes into the clinic having been diagnosed about 3 years ago, maybe a little over 3 years ago. She is taking medication, metformin, as well as a type of insulin. And she also has other issues, right? She's not just diabetic. Usually these health issues are compounding, right? You don't just have diabetes, because diabetes is a metabolic systemic condition. Normally there are many other issues. So this patient was also on large amounts of high blood pressure medication. Her blood pressure was 138/86 with medication. Okay, that's with medication. So it's still on the high side, just barely below 140. With the medication she's taking, her fasting blood glucose is at 136 with the medication. So what do we do with this patient, right? Well, I will tell you, it is going to be fairly similar to all of our patients, right? We need to take the time to identify what exactly is causing the problem, and so what do? We take a detailed history. We do a comprehensive physical examination, and we take the appropriate laboratory tests in order to find out what exactly is causing the problem, right? We need more information about the cause of the problem. It doesn't help us too much to know that someone is already sick, right? You get that lab back from the laboratory. It says your fasting glucose. It says your HbA1c. It says your glucose tolerance test, and they say you have diabetes, and that's great. And they start you on medication. But what we want to figure out is what exactly has caused those changes in your metabolism, right? So with this patient, we do a very, very detailed workup, and then we find out if she's a good candidate for a fast. It turns out that she is a great candidate for water fasting. We put her on a fast. She only does a very short 10-day fast, and at the end of her 10 days, she has lost over 25 pounds. Of course, we prepared her for the fast, so she's eating a very healthy diet before she goes on the fast, and you do experience a significant improvement in most conditions when you start eating healthfully. So she lost some weight before the fast. We fasted her. Of course, she was monitored by our skilled professionals at all times at our inpatient center, which is a residential center specifically for patients who are fasting on water. Okay, all of our water fasting patients stay with us at our residential center. So her blood pressure dropped, of course, from 138/86 with medications to 102/70. Okay, that's 102/70. Sin medicamentos. Okay, that's 102/70 without medications. So you get about that's a 36-point drop, but not including the effect of the medication. So it's actually quite significantly more than that, okay? 102/70 is a great blood pressure, right? That is a very, very healthy blood pressure. If anybody knows anything about blood pressure, give me a thumbs up. That is a perfect blood pressure. 110/70, 100/60, even 90/60. These are great blood pressures. We see them on a much more regular basis in societies that eat a healthy integral plant diet, okay, where they're not eating a bunch of things they shouldn't be eating. You find that their normal blood pressures are much lower than the normal here, where most people are sick, and a significant amount of the population, 1 out of 3 people, has high blood pressure. So then the normal starts to climb the ladder there. But a real normal blood pressure is around 102 over 70. That is perfect. Her fasting blood glucose, all right? We're talking about diabetes today. What is her fasting blood glucose? Well, I will tell you, it is 75, okay? Before her fast, her fasting blood glucose was 136 with medication. Now, she has a fasting blood glucose of 75 with no medications, right? With a 75 fasting glucose, you don't want to touch that with medication, right? That would be very dangerous. So, exactly what are we doing to reverse these conditions? Well, I would first say that we do not treat any of these conditions. And I'm going to answer one question and then I'll get back to that. Esperanza, you're asking, the fast is only drinking water, no solids. That is what a water fast is. Okay? The definition of a water fast is only drinking pure water, not consuming any other type of food or drink in the environment of rest. So this is a controlled resting environment where you are monitored by doctors who have experience in water-only fasting. Okay? We do not treat conditions, right? We work with patients in identifying the causative factors of their loss of health. Fasting is not a magic pill, right? We prepared these patients with proper diet and lifestyle advice before they came to our residential center and stayed with us. Okay? They were instructed to eat a diet abundant in fruits and vegetables and avoiding animal products, sugar, oil, salt, and flour. Okay, this is an abundant diet. We did not restrict their diet in any way except having them eat only the foods that are going to get them healthy and none of the foods that made them sick in the first place. Okay? Thumbs up? Give me a thumbs up if you guys heard that. Everybody can hear me, right? My mic's still working? So, now I know what you're going to ask me next, right? Everybody is saying, oh, well, that fasting, that's too much for me, right? That's a little extreme for me. So can you get these results without fasting, right? Can you get these results just by eating a very healthy diet? I will tell you that when you change your diet, then when you make a significant change in the food that is going through your bloodstream and your cells on a daily basis, you will see some significant changes, okay? However, it is very difficult to change a diet from a poor diet to a healthy diet for an extended period, right? This is not an easy thing to do. In fact, it's very difficult. It's akin to getting rid of, getting off of nicotine and smoking cigarettes, to quitting alcohol, to getting off any other type of drug, okay? So we do fast many of our patients for two reasons. One reason is that before the fast, many patients do have trouble adapting and continuing or succeeding eating a very, very healthy diet. Why? Most of the reason is because the healthy diet doesn't really taste good, right? You start eating broccoli and spinach and celery and cucumbers and fruits and vegetables and complex carbohydrates without all of the stimulation of the animal products, the processed foods. The food is really not going to taste good at first. Okay, it's going to taste like dirt. Okay, wood, cardboard. It's not going to taste good. Gruel, tasteless swill, whatever you want to call it. There's not a lot of flavor there. When you fast, your taste buds are able to neuroadapt. The brain chemistry is able to neuroadapt, and the food, the good food, does begin to taste good. And this is how our patients are very successful continuing with a healthy diet. After you fast, fruits and vegetables are going to taste like heaven, right? They're going to taste like candy. You don't believe me, but that is what happens, right? After a fast, after 7 or 10 days on water, you go to eat that first watermelon and that first bite of cucumber, you're going to taste that sugar in the watermelon. That's going to hit your tongue because your taste buds have reset. The salty taste from the cucumber and the celery and all the rest of the vegetables that are high in sodium, you're going to taste that salt, okay, that salty taste. So another reason that we do fast many of our patients, of course, some of our patients don't fast. We often put them on juicing programs or other types of liquid diets, or there are several ways to progress, to improve diabetes without fasting. However, it is nice to get results very quickly. It's nice for me. I mean, I love to see that, but it's really great for patients because sometimes eating a very, very clean diet takes a long time to see results, or the results come very slowly. And that can be a problem because that's very frustrating, all right? Eating this healthy, tasteless diet day after day after day, if you're not really seeing any results, that can get very frustrating and people tend to fail, okay? So if we can find a way, we utilize fasting very efficiently to see results very quickly. Okay, some of those results that you might see with 6 months of eating very clean diet and resting enough, getting enough sunshine, drinking enough water, you might see those results in maybe a week and a half to 2 weeks of fasting. Okay, so the speed at which you get those results a lot of times makes it more fun and exhilarating for those patients who are trying to get better, right? If you're trying to get better and you're not really seeing the results, you get frustrated. It's very hard to stick to dietary or lifestyle changes when you're not seeing the results. But with fasting, we can see those results very quickly. And so that gives patients sufficient motivation to continue that lifestyle afterward. Okay? I gave you guys 2 great case studies there. Again, these are not miracle patients. These are regular patients that we see on a daily basis in our clinic. I just happened to choose their cases because they're interesting and they show the broad spectrum of people that do come in and can succeed when the causes are addressed. If you enjoyed this, please give me a thumbs up, give me a wow face, give me a heart, whatever you want. I hope everybody enjoyed this. I will take some time for questions. If you guys want to ask whatever you want to ask. Dioris Martinez, the time in water detox depends on how many diseases. Well, when we're trying to figure out how long someone needs to fast, it is appropriate to do your proper homework, right? We need to take a history, find out exactly what's going on, do a physical, do appropriate lab tests, so we can find out if that patient is a candidate for fasting. Some patients should absolutely not fast, and we have to, alter the programs based on what they can or can't do. To give you an idea, okay, of how long somebody really needs to fast, preventative care. If you're trying to just remain healthy, you want to, do a short detox, clean out your arteries a little bit, reset your palate, right? Reset that neurochemistry and the taste buds. Then you want to fast for about a week to 10 days. Okay, that's sufficient to make those changes and then adopt a very healthy lifestyle and diet after that. However, if you have some honest-to-goodness diseases that you're trying to improve, symptoms like gastritis and acne and psoriasis, rheumatoid arthritis, systemic lupus, ulcerative colitis, any kind of inflammatory joint or bowel condition, hypothyroidism. We're talking about high blood pressure and diabetes as well. If you got something that you're kind of struggling with and you want to get out from under, that may require a longer fast. These fasts range anywhere from 2 weeks to 30 days. A very common number in our office is around 20, 21, 22 days. That's a pretty good fast. And often some of these fasts, some of these conditions do require more than one fast. This is just the nature of health. It does take time to heal, and certain conditions, especially if they've been around for long enough, they will require more than one fast. Esperanza, you're talking about, I'm not sure what your question is. You asked about cancer, but give me something more detailed to talk about. Cancer is a huge subject. Okay, we do see cancer patients here in the office. Some of them decide to do conventional treatment along with a health program, and that typically turns out very, very well. If you would like more information, okay, you want to know more about our services, maybe you want to buy our ebook. We have 2 different types of ebooks on our website. Go to the website, is backtothegardenpr.com. Buy a book. Everything in that book is free of animal product. It's also free of oil, salt, sugar, and flour. So you can be sure that anything you eat in there is going to benefit you and not kill you, right? Learn more, right? Start listening to videos and asking questions, okay? Always be asking questions, because the truth is obvious, okay? It's obvious. You just have to look hard enough and long enough, and it will come. Okay. That is about it for today. Thank you guys for joining in. I hope everybody enjoyed that. We will see you next time. Oh, by the way, if you would like to know more about fasting, please go see my video from about 2 weeks ago. It is called Top 5 Reasons You Should Do a Water Fast. Okay? Go there. You'll find out a lot of more information specifically on fasting. And comments below, let me know what you want me to talk about next week, okay? Let me know what you guys want to hear, all right? See you guys. Bye-bye.